Hi everyone, this is Dr. Swathi, consultant gynecologist at our Ciclehealth. So today I will be talking a few words regarding the basics of infertility. That is, when do you call yourself as an infertile couple and what are the diagnostic modalities that are available as of now? When do you call yourself as an infertile couple? So when you are trying for pregnancy, you're planning for pregnancy and you have regular intercourse at the fertile window of your cycle for at least a period of 4 to 6 months and still you are not able to succeed, only then we call them as an infertile couple. Definitely this definition holds good for women at reproductive age group, that is at 20 to 30 years. So if you cross 30 years, you might need evaluation at an earlier stage as well. So coming to, we get a lot of patients saying that at very young age group, maybe 24, 25 years of age, and still they say that we have been planning for pregnancy since 2 months, we are having regular intercourse at the fertile window, but still it's not happening. No, it is okay. You have to give it persistent efforts for at least 4 to 6 months because the chance of you getting pregnant, even if you have intercourse at the fertile window, is only 20%. So coming to what are the various diagnostic modalities that we do when an infertile couple approaches us. So for women, we do certain basic hormonal profile testing which is related to their ovulation. Also we do thyroid and prolactin levels, and depending upon the symptoms we might need further investigations as well. And also we do a basic scan called as the ultrasound pelvis. So this scan gives us a very good information regarding your reproductive system, your uterus, the lining of the uterus, how are the tubes and the ovaries. So the ovaries, if you have any polycystic ovaries, or also we check for something called as antral follicular count. So what is antral follicular count? This is the count this is the scan modality which tells us regarding the ovarian reserve of a woman, that is how many eggs is she capable of growing in that particular cycle, and it gives a lot of information regarding the reproductive capacity of the woman. And also we have to evaluate, and it is very essential to examine the husband as well. So we do a basic test called as the semen analysis, wherein we get to know regarding the sperm motility, if there is any structural abnormality in the sperm count, and if the sperm is healthy enough to fertilize the egg to cause the pregnancy. So the husbands has to be evaluated because they almost contribute to more than 15% of the pathology in case of an infertile couple. So these are the very basic investigations that we do, but if we find any pathology or we suspect something else, so there are various diagnostic modalities available to identify where exactly is the problem, and also further we can give treatment accordingly. So stay tuned for more such videos where I will be educating you regarding what are the various other diagnostic tests, so what is fertile window and how do we go about for planning of pregnancy. See you soon.